Hello, good afternoon, good morning, and good evening, wherever you're watching us. We are back for another Ask WHO Social Media Live Q&A. I am Yanowit, and I'm very happy to be your host for today's session live from Geneva, Switzerland. If you follow us on social media, last week on the 5th of May, we celebrated the International Day of the Midwife and also the launch of the 20 and 21 State of the World's Midwifery Report, which is called by UNFPA, WHO, and the International Confederation of Midwives. And also tomorrow is International Nurses Day. So that's why we are having a live conversation with you today. And it is my great pleasure to have with us in the program our technical focal point for WHO nursing and midwifery workforces who worked on this newly launched report. Welcome, Dr. Kerry McCarthy. How are you doing?
Good. Thank you for having me.
Yeah, first and foremost, congratulations on the successful launch of the report last week. I'm wondering if you could give us some introduction or maybe tell us more about the theme of the report and why this report is important to all of us.
Yeah, thank you, Yanuit. Can you hear me?
Yes.
Okay, great. So the State of the World's Midwifery 2021 report is a really exciting achievement by WHO UNFPA, which was the lead agency, and the International Confederation of Midwives. This is the third time this partnership has created this report. And the theme of it this year is building a workforce to meet the needs of women, newborns, and adolescents everywhere. So we know that sexual, reproductive, maternal, newborn, and adolescent health services are an essential component. Providing those services is essential to achieving the Sustainable Development Goals. So we really have to have an increased commitment to an investment in the health workforce that's delivering those health services. So that's why this report is exciting, because for the first time, we're really able to describe in great detail, and for a lot more countries than ever before, what are the size and dimensions of this health workforce in all these different countries. And also it's important because it comes partly as a result of the year of the nurse and the midwife, which was 2020, and it comes during the year of the health and the care worker, which is 2021. So we're really able to leverage this advocacy for health and care workers and provide this important report providing evidence to support the advocacy campaigns to really invest in and protect all of our health workers together. And as I mentioned, this is the third in a series of prior reports on the state of the world's midwifery were in 2011 and 2014. So now we have this third report, which also can help us see changes over time and where we're making progress and where we're not making progress. So those are some of the reasons we're really excited about the launch of this report with our partners.
Thank you very much. That's a great introduction. But before I get back to you in just a second and discuss the report in more detail, let me also welcome our viewers who are joining us from all around the world as usual. Our focus today is on the 2021 State of the World Midwifery Report and ahead of International Nurses Day tomorrow. Any questions related to this topic, midwifery or nursing, are most welcome. To ask your question on Twitter, use hashtag AskWHO. And those of you who are watching us on Facebook and LinkedIn, simply leave your comment in the comment, leave your question, in the comment section. We have a whole team of us monitoring and curating your questions, so feel free to do so. Now let's dive into more details of the report. Dr. McCarthy, what are the highlights or key findings of the report that you want to share with our viewers today?
Well, I think the most important finding is that we don't have enough sexual, maternal, newborn, adolescent health workers to achieve universal health coverage. And where we do have them, they're not adequately distributed across the world to achieve UHC. So we have a big shortage of these type of health workers. And the biggest among those shortages is of midwives. And this is really important because midwives can provide 90% of the essential sexual, reproductive, maternal, newborn, and adolescent health services. So a huge range of these essential health services. But we found that they're less than 10% of that workforce overall. So it's a big opportunity there for countries to invest in midwives and optimize their contributions to sexual, reproductive, maternal, newborn, and adolescent health. But that's really an area we need to focus on, is investing in midwives and creating more jobs for midwives so that they can contribute in these wide array that they can. So that's a really big finding, was the shortage. The shortages primarily are most stark in WHO areas of Africa and the Eastern Mediterranean region, in terms of those shortages right now. So what the report does is outlines where and how we need to invest in midwives to address those shortages and optimize the contributions of the midwifery workforce in particular.
All right, but before we take the first questions from the audience, Dr. Mikati, you mentioned that the report highlights that the world still needs more midwives, 900,000.
900,000, yeah.
The exact, and this shortage is unfortunately not equitable globally. So could you please tell us a bit more, what are the implications or impacts of this global shortage of midwives, and how big is the issue here?
Right. So right now the shortage is 900,000, and as you mentioned, it's more heavily seen in Africa and the Eastern Mediterranean region. If we don't address the shortage now by investing in midwives in a number of different ways that the report details, by 2030, the shortage will be slightly decreased to about 750,000, but not in the areas that need it most. So we actually won't be making progress to universal health coverage and the SDGs unless we really focus and invest in midwives where they're most needed. There is a study that's cited in the State of the World's Midwifery Report and was actually published in The Lancet in December 2020 that did some modeling to show that if midwives are fully invested in and they're enabled, we have coverage of all these this essential sexual, reproductive, maternal, newborn, adolescent health services, that we could avert almost 2/3 of maternal deaths, neonatal deaths, and stillbirths. And that could have a huge impact by 2035 on the lives saved. The modeling looks like over 4 million lives could be saved. So the impact of investing in midwives is really, really strong. So we encourage countries to invest in a number of different areas. And we try to give some good policy options for countries on how to do that.
Well, thank you very much, Dr. McCarthy. All right, we now have some questions started to coming in from our live audiences, and thank you very much for sending those, folks. Seeing the first question here from a viewer on Facebook. The question is, what is the midwives and nurses gender balance?
Good question. In the State of the World's Nursing Report, which came out in 2020, we found that globally nurses are 89% female. This varies between 75% in the WHO region of Africa to 95% in the Western Pacific region. So about 89% globally, though. For the midwifery workforce, globally it's 93% female. The sexual, reproductive, maternal, newborn, and adolescent health workforce overall is about 70% female. But again, midwives themselves are 93% female.
All right, thank you. So we have one more interesting question from one of our viewers on social media. Is there any particular or additional personal protective equipment or PPE recommended for nurses and midwives working during the COVID-19 pandemic?
Yes, thank you. Yes, nurses, midwives, all health workers have been incredible in their response to the pandemic. We absolutely say all health workers need to be protected. They need to be vaccinated. They need to have the supports in terms of personal protective and other health equipment and occupational and health safety standards. There's being respected. Some really big issues for midwives are being able to continue their work in the communities. Midwives work really closely in the communities. They're trusted members of the communities. So being able to maintain those services in the communities, especially when people were hesitant to go to the hospital, those were some challenges for midwives. But also for all health workers, it's been, it's really important to have adequate and fair pay for midwives. Midwives are, as we said, predominantly female. So ensuring that there's fair pay, especially in COVID, that there's fair, timely pay, overtime pay, hazard pay where that's indicated, that there are mental health support, that there's adequate leave and health insurance support, these kinds of supports. WHO has a great some great resources on their website in terms of how countries and governments and health systems can support their health workers during COVID-19 pandemic and in all contexts.
All right, you mentioned about taking care of mental health midwives. I have one question from a viewer on Facebook, Dilian Manolov, asking how to care better for the mental health of our young midwives.
That's a great question. I think there are so many challenges, I think, in that healthcare workers are facing now in the context of the pandemic. And we have there's a lot of even maybe some hesitancy for young people to consider going into the health profession, to consider going into midwifery. So we want to really be able to develop and attract the strong midwifery candidates, strong healthcare worker candidates, and especially develop and attract them in the communities that they want to serve and in the communities where they're needed most. So we also actually just developed some guidelines, actually updated the 2010 guidelines to 2020 on how to develop health workers and recruit and retain them in the areas that they're needed most. And a lot of the support that's needed for health workers and part of the retention and attraction is ensuring they have the supports necessary in the workplace. And some of those challenges that contribute to stress, to burnout, to mental health issues need to be part of the supports that are in the workplace. So in the State of the World's Midwifery Report, there are some key recommendations about and policy options for ensuring that the workplace is an area that there are mental health supports and what those might look like and what to take into account when you're thinking about developing the next generation of midwifery leaders and developing those health workers that can work in their workplaces and be motivated and protected and equipped to deliver the health services that make such an impact on people's lives.
Thank you very much. So as we are still living in the global pandemic and nurses and midwives have continued providing life-saving services during this unprecedented health emergency of our time, I'm wondering if you could tell us more about the role nurses and midwives play in the fight against COVID-19 and in improving people's health and well-being.
Yeah, it's a great question, especially since we've come just off the International Day of the Midwife, and International Nurses Day is tomorrow, and we can really celebrate the contributions of these two workforces while we are in the year of the health and care worker, where we really need to invest and protect together all of our health and care workers. I think we hear a lot about midwives and nurses being at the forefront of care delivery, but they're really in almost all settings across health systems and across the whole lifespan. Midwives in particular, this report details how midwives are providers not just of maternal care, antenatal and maternity and postnatal care, but they also provide essential services in sexual and reproductive health of women, of adolescents, of disadvantaged populations, and they're able to continue. We would need to make sure that they're able to continue providing those specialized services to vulnerable and disadvantaged populations. There's a really great set of web appendices to the State of the World's Midwifery Report that aren't in the main report, but they're focusing on making sure that adolescents receive the sexual and reproductive care that they need, and how to ensure in fragile conflict and vulnerable settings that midwives are able to continue providing this essential care and leave no one behind. And that's really an amazing role that midwives have for a number of communities and across the lifespan. So we're really glad that this report draws that out, and hopefully that messaging about the importance of midwives to all different types of community members and populations comes out really clear and strongly.
Thank you very much, Dr. McCarthy. Just a reminder for all of you who just joined us, our program today is on the 2021 State of the World Midwifery Report, and ahead of the International Nurses Day tomorrow, we have Dr. Kerry McCarthy here with us to answer all of your questions. You can send over your questions or anything that you wanted to share with our expert using hashtag AskWHO on Twitter, or leave your question in the comment section if you're watching us on Facebook or LinkedIn. So here are quite a few questions coming in now, Dr. McCarthy. The next question is from a viewer on LinkedIn. The question is, how can we increase a number of midwives in the rural areas, like in the African region?
That's a great question. That's a great question. We have the State of the World's Midwifery shows that disparity and that some of the need is greatest, particularly in the African region. So the State of the World's Midwifery report has a number of different policy options and areas that are encouraged for bold investments to invest in midwives, where and how to invest in midwives, and particularly to recruit and retain them in the rural and remote settings. There is also there's a 2020 updated guidelines on development, attraction, and recruitment and retention of health workers in rural and remote settings. So I encourage you to look at that publication. It's not out yet. There's a systematic review showing all of the evidence and guidelines, but really a lot of the key findings are about needing to bundle interventions and make interventions to retain and develop, recruit, and attract health workers specific to the context and specific to midwives. We've seen that for midwives, it's really important that they're able to work the full extent of their education and training, and that has a lot of impact on motivation and job satisfaction for midwives, and being valued and respected members of the teams, of the healthcare worker teams in which they work. Being able to have those supports, like in referral mechanisms to higher level care facilities, are extremely important for midwives working in rural and remote areas, and making sure that midwifery patients are able to be integrated into the health system when referred. So there's a number of things. There's general guidelines for recruiting and retaining health workers in those types of areas, and then also some things that are really important for the midwifery work, and making sure that their contributions and their work is fully enabled so that they really drive the progress and impact that they can towards universal health coverage in our SDGs.
Thank you. There's another question from a viewer on Facebook asking why nurse or midwives patient ratio is not a quality indicator yet. Perhaps you could share with us, with the viewers, the ratio of nurses in hospital and in community area, maybe.
Yeah, thanks. I think it's a lot of countries feel that they have a shortage in their health system. The ratio of nurses and midwives to patients is inadequate. You rightly point out, we didn't have that as an indicator in the State of the World's Midwifery report. We really looked at describing the health workforce, helping countries understand what the size of their sexual reproductive newborn adolescent health workforce is, because understanding that workforce, where and how they're distributed is the first step to being able to plan your health workforce and plan the health workforce according to the own system, health services delivery, and the health system design, to make sure that nurses and midwives and other health workers are all in those areas to deliver services where they're needed most. So what we focus on for this report is helping countries get a sense of their workforce, where their midwives are, and use that for planning. We also have a number of tools that countries can use to analyze, to be able to, once you understand those numbers, to analyze those numbers, to plan and manage the workforce so that health service delivery needs can be met with midwives as part of wider workforce teams.
Thank you very much. Here's another interesting question from one of our viewers, and asking, what is WHO doing to address the global shortage of nurses and midwives? Well, for this question, I think to follow up on what you just said earlier about the global shortage, perhaps you just explain what is WHO's role in building a health workforce to meet the needs of women, babies, and adolescents, and also perhaps concretely what WHO is or has been doing to support nurses and midwives around the world.
Right. Yeah. Another great question. So WHO works at all of its locations, from the headquarters to the 6 regional offices to all of our country offices, to support countries to make sure that their health workforce is optimized, contributing in the greatest way to population health needs and population health goals. So so there's a number of resources available. The global strategy for health workers, Health Workforce 2030 is available, and there's lots of tools and resources, as I mentioned, to help understand the health workforce and how to optimize those contributions. In the State of the World Midwifery Report, it's all those resources are referenced, and then we really direct readers to the key areas where investments are needed, and these are all in line with the overarching health workforce strategy. But for midwives in particular, it's really this report details the importance to invest in education and training, for example. The report found that a lot of midwife educators aren't even midwives because of the shortage. So we need to not only strengthen the education institutions, but strengthen the midwifery educators who can teach in those institutions and develop the next generation of midwives. We also saw that there's a big need to invest in midwifery leadership, that only half of countries have actually a senior midwife in the government, in the Ministry of Health. And that voice of midwives is really needed in health services delivery, health system design, and these models of care that are midwife-led within interdisciplinary teams that can really make the impact on health of populations that we talked about earlier. And then also working on the health workforce management, the management of the midwifery workforce. So understanding really how to get midwives in the communities and supported in those communities where they're needed most.
Thank you, Dr. McCarthy, for explaining this to us. Also, the report highlights that we need to invest more in midwives and also nurses, of course, to achieve health for all. So what exactly do we mean when we talk about investing in nurses and midwives? And what are the impacts that we could see from these investments?
Right, yeah. What do we mean by invest? That's so much messaging on the advocacy and the campaigns to invest. So it really means taking a look at the country context in general. And so the State of the World's Midwifery Report, for example, provides a country profile with every country's data that they reported, analyzed, and produced, and that's on the UNFPA website. So the first step is getting a sense of the health workforce and what data the country has and what data the country needs, and understanding where investment is needed. And that's the intent behind the State of the World's Nursing Report, the State of the World's Midwifery Report, so they can make those decisions about it. But investing might be, seeing that if there's a shortage of midwives, creating that economic demand for midwifery jobs in the health system, knowing the range of services that midwives can provide, how to best place them, and understand the number of midwives that need to be in the health system so that they can really provide all those services to the full extent of their education. It might be understanding, deciding to invest in more graduate midwives, so investing in education and strengthening the quality of education, and investing in ensuring there's enough educators to educate them, so there are enough graduates to come out of to come into the health system and fill those jobs for midwives. So it might be investing in employment and the education. It might be investing in the workplace to make sure midwives are enabled. They have an enabling environment to provide the range of care that they provide. So it could be any one of those areas. And we know that investing in the employment and education of health workers not only has an impact on the SDGs that we've been talking about, SDG 3 in terms of health, but we know that investing in health workers, employment and education actually helps advance SDG 4 for education. And because if you're educating, employing midwives, you're educating and employing women. So you're really driving increases in economic participation of women, employment of women, and that education of women and girls, which is SDG 5, and investing in these things in the workplace. And women, you're in improving decent working conditions and inclusive growth, which is SDG 8. So really, by investing in midwives and health workers in general, we actually can drive progress across a lot of the SDGs. So that's the impact that we're really going for. That's an exciting, hopefully, outcome of these reports.
Oh, thank you very much for a very detailed explanation. All right, I will take a couple more questions before we end our session today. We have a question sending in on LinkedIn from Fatima. The question is, how can midwifery services be developed in developed nations?
Yeah, thank you for there's great policy options in the State of the World's Midwifery Report to try to highlight what some of the biggest areas of need are, and how to develop those, where to focus in terms of those, developing the education systems, the educators, the work environment, and also the regulations. So making sure that that midwives' work is protected, that there are regulations that define what is a midwife, and what the scope of practice of a midwife is, what the essential competencies of midwifery graduates are. So there's all these different supports that midwives need, and the infrastructure that needs to be developed and strengthened in many countries to make sure that midwives are the huge contributors and to health service delivery and positive health outcomes for women, children, and adolescents. So there's these areas that we know we need to focus on and invest in more in the State of the World's Midwifery Report. There's also some great resources on the WHO webpage in terms of strengthening, in particular, midwifery education. There's a new last year guidance on how to develop midwifery education for achieving universal health coverage, and a number of other normative work on terms of the delivery of health services, and how those can be done in a way to optimize health services delivery to achieve those population health goals.
Thank you. Here, another, well, very interesting questions from a viewer on Facebook. Actually, there's two questions that are related. So first, how can we motivate young people to become a nurse or a midwife? And another question is how to motivate more men learning out midwifery skills.
Thanks. Yeah, I think it's, as we talked about a little bit earlier, it's a challenging time to try to encourage people to go into maybe to nursing, midwifery, and healthcare. I mean, the pandemic has really shown some of the ways that we need to increase investment and protect our health workers. So I think if the questions are about nursing and midwifery in particular, I think we need to understand what are the motivators to come into these professions. And I think for a lot, it's wanting to contribute, wanting to have those competencies to make an impact on healthcare, on health of individuals. It's, as we talked about, also nursing and midwifery are highly gendered professions. There's a lot of occupational segregation by gender in these professions. And so what I think is important is making sure that the care providers are representative of the populations that they serve, no matter what populations those are. So there's things that we can do to attract potential nurses and midwives into the workforce and into those health education programs. And some of them might be actually things like subsidies and stipends and ways that we can help support students to come into the health worker education. And then things that proper incentives and appropriate incentives to motivate them to stay there. I think there are definitely gender stereotypes in nursing and midwifery, and I think those can result in an undervaluing of the work of nurses and midwives. This is talked about in the State of the World Midwifery Report. So I think on ensuring that trying to have a gender transformative work environment for midwives is really important to attract a diverse group of people into the profession. And so it's really dealing with those issues of hierarchy and power and pay and leadership and bias, and that the harassment and discrimination and violence. And we really have to make sure there's a zero tolerance policies for those things in the workplace. I think that's something that we can do to incentivize and motivate people to come into the profession, knowing that it's a fair place to work and make your contributions.
Well, thank you. So we talked a lot about government support and WHO support. So A lot of people on social media are asking, how can individuals support nurses and midwives?
It's a great question. Everyone has a role to play to make sure that our healthcare workers are protected and motivated and supported and equipped to deliver health services in the pandemic and in all contexts and in all places. That's part of, that is the main focus of the campaign of the Year of the Health and Care Worker. And we have a great webpage on the WHO website that people can go to and see how to get engaged. There's so many different options, and we're really encouraging everyone to get involved, to invest and protect together is the campaign slogan. So please visit our webpage for all kinds of ways and suggestions about how you can get involved in supporting midwives and other health workers.
All right, so we talked a lot and in depth about midwifery and nursing and the latest report that just came out last week. And I'm sure that there's a lot of midwives and nurses who are watching us right now. Also, tomorrow is International Nurses Day. So, Dr. McCarthy, what message do you have for nurses and midwives watching us right now?
Oh, thank you for all of your incredible work. We're really excited to celebrate midwives and champion the need for investing in midwives. Report also for International Nurses Day tomorrow. The same. We're really excited to celebrate you. We know that applause and celebration for nurses and midwives is not enough. That's part of the theme of the Year of the Health and Care Worker campaign. As applause is not enough. We need to invest and protect our health workers. For International Day of Midwife and the Nurse, something that I'd want to point out is that these two reports, the State of the World's Nursing Report 2020, the State of the World's Midwifery Report 2021, are not just intended to be reports that sit on the shelf. These country profiles are intended for you to be able to have the data, see the data, see the needs and priorities, see the needs and against the priorities in your country, and figure out how to advocate for investment in nursing and midwifery. We know that these reports also were really key in developing the strategic directions for nursing and midwifery. So this is a document, a strategy that was requested by WHO member states. I think seeing the evidence from the State of the World's Nursing Report and the State of the World's Midwifery Report really showed that action is needed. We need to be able to invest in nurses and midwives and understand how and where. So these two reports actually contribute to that evidence that's driving the action by member states. So at the World Health Assembly next, as on the 24th of May, member states will be looking at the global strategy for nursing and midwifery and endorsing that strategy, we hope. And that will be the time to really hold them to account that they agreed to supporting nursing and midwifery in these ways. And so this is a great opportunity to take action yourselves and see this political action at an exciting level by ministries of health, how to take that forward and how to use those policy options in the strategic directions for nursing and midwifery for enacting change in your country to support nurses and midwives and their contributions to health for all.
Well, thank you very much, Dr. McCarthy. That is a very nice point to end on. Action is needed right now. All right, if you want to learn more about WHO work around nurses, nursing and midwifery, or if you want to download the report, the 2021 State of the World's Midwifery Report, please visit our website, www.who.int. So I'm so sorry that we are running out of time now. Thank you everyone for sending in questions and for tuning in from all over the world. So from South Africa, India, Jamaica, Costa Rica, Zimbabwe, Jordan, Switzerland, Brazil, USA, Turkey, Canada, Spain, Ghana, Indonesia, Botswana, Peru, Japan, France, Germany, Philippines, Denmark, Cambodia, and many others. So thank you for tuning in. Thank you for celebrating and showing your support and appreciation for nurses and midwives around the world. And thank you, Dr. McCarthy, for taking the time to talk to us today. Please stay tuned and follow us if you haven't already on our social media for upcoming activities that might interest you. And stay safe, stay healthy, and until next time.
Bye. Thank you so much.
Thank you.